Hello, I'm Dr. Bill Gradisher, Professor of Medicine at Northwestern University. I direct the Maggie Daley Center for Women's Cancer Care and have been on the faculty there for 35 years. And today I'm going to be talking to you about hair loss, one of the common consequences of getting what we call cytotoxic chemotherapy. And it is one of the things that I know can be quite devastating to many patients. It makes them feel like a patient. And as a result, it can have an impact on your quality of life, your self-esteem, and a variety of other things. So we don't minimize the impact this has on a patient, man or woman, who's undergoing chemotherapy. Now, one of the issues that people often confront is, why is it that I have hair loss? And again, if you think about how chemotherapy works, it's meant to affect rapidly dividing cells, which are frequently thought to be cancer-like cells are rapidly dividing. That's generally the case. Some are more slow growing, but there are normal cells in your body that are also rapidly dividing. So that includes hair follicles, which organ, in a sense, that makes the hair, and that's constantly turning over. That's why we need a haircut. And if you interrupt the ability of the hair follicle to do what it normally does, it results in first retardation of hair growth and then ultimately loss of the hair follicle. The other consequences of chemotherapy that are sort of in the same category is if you think about what chemotherapy does to your blood counts. Your blood counts are constantly turning over under normal conditions. And if you use chemotherapy, that's why blood counts drop. These are rapidly dividing normal cells. And similarly, certain chemotherapy drugs can affect the GI tract and cause consequences there. So the effect of chemotherapy is largely an effect on rapidly dividing cells. The true target, of course, is the cancer cell, but one of the collateral damage effects, in a sense, are the hair follicles. So what can we do to mitigate or minimize that side effect? Well, there have been strategies over the years to look at different systems that could preserve the hair follicle or protect it, in a sense. Early on, there was some concern that if you use different strategies that would minimize the amount of blood flow to the scalp, that somehow the chemotherapy drugs might not get there, and as a result, patients might develop metastases on their scalp. And that has largely been disproven. We don't have that concern. So the strategy that has been employed in a broad sense is to cool the scalp. And what does that accomplish? Well, it causes vasoconstriction, which means you get the diameter of the blood vessels that go into the very small blood vessels that go into the skin of the scalp are shrunk. They decrease in caliber. And what that accomplishes is the drugs that you're receiving for the treatment of cancer have a harder time getting to that one specific area, in a sense, protecting the hair follicles. So there are two strategies that are currently used to try to decrease or eliminate hair loss related to chemotherapy. One is cold capping, and these are gelled caps, literally, that look like sort of old-time football helmets that are chilled either in a freezer with dry ice, and they have to be switched out every 20 or 30 minutes to maintain the scalp temperature at a low level. And again, what the goal is to decrease the blood flow into those tiny blood vessels that feed the scalp and feed the hair follicles, thereby letting less of the cytotoxic chemotherapy to the hair follicles. The cost of this is anywhere from $400 to $500 a month, and insurance may or may not cover this. And the other strategy is actually cooling machines, scalp cooling machines, which are often at the site where you're receiving treatment. With cold caps, you bring in a chest, a cooler, and you have all the necessary equipment that you actually bring with you. Scalp cooling machines are actually present in the clinic or in the hospital where you receive the treatment. And these two are relatively expensive, and it's dependent on what insurance covers, but they can be several $100s a month. But that's a system that's constantly on while you're using it, whereas with the cold capping, you have to be changing every X number of minutes. You have to start before the chemotherapy starts with both systems, and you have to continue it after the chemotherapy is done, because you want to make sure that while the chemotherapy is still circulating in your body, the vasoconstriction of the blood vessels in the scalp persists in being of smaller caliber, so less of the drug is getting to the hair follicle. The net effect is the hope that that will result in an improvement in maintaining your hair. It's not perfect, but many patients, at least to an outside person looking at you, you look like you have a normal head of hair. Patients may still sense they're losing some hair, but it's much, much less than not doing a scalp cooling, either with caps or with the machines. The other thing that I think has to be emphasized is it's not 100% effective, and it's somewhat dependent on the drugs that are being used. So taxane, which is a kind of chemotherapy class of drug, cold capping and scalp cooling appears to be pretty effective, whereas with anthracyclines, less so. As we get into newer kinds of drugs like antibody drug conjugates, immunotherapy, the effect of these measures to decrease hair loss is still being studied. But for standard chemotherapy, we have a pretty good feel for what these drugs are able to do. And where we commonly use them most is in patients with early stage disease who are getting a finite period of time with chemotherapy, after which they're done and their hair should return to normal. So breast cancer is complicated, and if you want to learn more about other topics that may relate to your situation, go to Yerbba.com, and you can also subscribe for a personalized report that would apply directly to your situation. We recognize that the number of issues that breast cancer patients face is diverse, and not every patient is the same as another. There are different subtypes of breast cancer, different treatment strategies, different side effects that patients experience. And to get more information, look at the catalog of topics that we've discussed at Yerbba.com. So there's some important things that I think you should always keep in mind. And that is, one of the most important thing is consistency. So if you start down the path of doing scalp cooling or cold capping or a scalp cooling machine, you have to be consistent treatment to treatment, because if you miss one, again, you're going to experience hair loss related to the chemotherapy. Typically, as pointed out, with either strategy, cold capping or the machines, you have to start the cold process before the chemotherapy starts, because you want to start the vasoconstriction before you're administering the cytotoxic chemotherapy that can affect the hair follicle. And similarly, you have to continue it after the chemotherapy is completed for a period of time, because the same issue occurs. The chemotherapy is still circulating in your blood even after the bag is empty or after the injection has occurred. So you will continue with cold capping or the machine for an hour plus after it. And what do you experience while you're receiving cold capping or the machine? You're going to feel cold. That's the idea. So if your head is cold, you can think about walking around in winter. Oftentimes your body feels cold too. So you have to make sure that you have warm clothing. Some patients wear gloves. Some patients have a blanket and sweaters. And you just have to sort of anticipate that you're not going to feel perfectly with something that's pretty cold on your head. But the net effect is that you're going to have more of your hair after completing treatment than you would have if you didn't go down this path. So I think that this is one of the things that impacts most on patients. It's something that oncologists are sensitive to, recognizing that it's patient's appearance that's important to them, and it gives them some sense of control by using these kind of strategies to feel as good as they can during a very stressful time during their life receiving treatment for their cancer. So if you'd like to learn more about this or other topics related to breast cancer, we encourage you to go to yerbba.com, and I think you'll find that many of the topics discussed will apply to your situation. Thank you.